Greetings, I'm Dr. Han Shik. Today I'm going to talk about how to remove connector after milling and about coloring. These are the contents for today. After milling, connector is removed, coloring before sintering. And I'm also going to talk about starting sintering. Once milling is done, from the disc, crown is removed. As shown, once milling is done, the disc is connected here. You remove it, and then connector is removed. Fissure bar is used to remove connector. Once crown is separated, as shown, denture bar is used to remove unnecessary bits. I'm going to show you how it's done via the video clip. From zirconia disc, crown is going to be separated. In the case of posterior area for milling, there's approximately 3 connector, 1 on buccal and 2 on the lingual side. In the case of premolar or anterior area, there's 1 on buccal side and 1 on lingual side, so 2 connectors. When you remove connector, as shown, use fissure burr, which is thinner. And this is most ideal based on my experience. For separation, you need to hold crown firmly and then do the cutting. If you hold it loose, as the crown comes off, the milling burr can damage the crown. You need to hold firmly and then do cutting. The 1 or 2 connector on the lingual side, you can use it as a hook to remove crown after sintering, so you can leave it, make it longer. It is not cut thoroughly, you leave a little bit behind. Now I'm going to move on to the buccal one. You remove cautiously. Crown is now separated from the disc. One of the 2 lingual connector is going to be used as a hook to remove crown. The connector on the buccal side, it obstructs in expressing color. Therefore, connector on the buccal side is thoroughly removed. In order to trim it gently, use narrow and smooth denture burr instead of fissure burr. Now I'm going to trim the rest. Connector on the buccal side has been removed, and I'm only going to leave 1 connector on the lingual side. Connector has been removed from crown. I'm going to use this one as a hook for removing crown. For premolar, there's connector on buccal side and another one on the lingual side. It is very close to the margin, and therefore you need to pay a lot of attention when you remove it. The lingual sprue is going to be used as a hook, so I'm going to make it long. Connector is going to be removed. I'm going to be very careful. It's thin here. If you rush, crown can fracture. Carefully, I'm going to remove the connector on the lingual side. This one I'm going to use as a hook, so I'm going to make it longer. As shown, crown has been removed from zirconia disc. After that, I'm going to make it smoother. In order to do that, rather than using fissure burr, using denture burr, which is smoother, is more safe. As shown, denture burr is used. You hold the crown very firmly so that it doesn't move in order to avoid damage to the crown. The connector on the buccal side is removed foremost because it obstructs with coloring. Connector on the lingual side is going to be used as a hook for insertion and removal. And this much length is going to remain. Once the occlusal adjustment is done, this can be removed. This is right after removing crown from the disc. There's one connector on the buccal side and two on the lingual side. Out of the two lingual connectors, one is kept so that it is used as a hook when crown is removed. One connector on the buccal side and the other on the lingual side is trimmed like this. After that, coloring begins. These are the three types of coloring kit that I use. On the left is Chang's coloring kit. Second, Luxin coloring kit. Third, UNC coloring kit are used. The first has a very strong effect, and therefore it can be difficult to use for beginners. Luxin coloring kit and UNC coloring kit, they are rather diluted, therefore, on the same area, even if you apply it repeatedly, there's little possibility of making a mistake. The coloring liquid, you can use it in a cartridge type brush or use palette and brush on the right. However, cartridge way is much more even and you can do it more precisely. Therefore, cartridge way is recommended. A2 shade, A3 shade is here, A3.5 shade, A4 shade is here. The base is determined with these colors. On the cusp to express enamel, there's enamel. To express orange on the cervical side, there's cervical color. The white opaque color is for severely discolored tooth or to block out the metal color of implant crown. It is applied on the inner surface of the crown. The gray color, it gives translucency. And it does not really give that dramatic effect. Last, on top of enamel, in order to give translucent effect, this agent is used. These agents, you can use it on the cartridge type brush and apply it. In the case of first molar, basically the occlusal surface is lighter and the more you go to the cervical area, it becomes more orange. A2 shade block is used and milled. You can make something bright darker, but it is difficult to make something dark brighter. Therefore, a disc with lighter color has been chosen. the shade on the cervical side and shade on the central side of the occlusal surface, they're very similar, and therefore on the cervical area and center of occlusal surface, I'm going to use a 3.5. Cartridge type brush, you can easily adjust the amount of the agent you're going to use. It is easier than using a brush. Cervical area, it has been applied. Now I'm going to do the same for the occlusal surface. For gradient effect of color, on top of a 3.5, I'm going to add another layer of A3 shade. For the cervical area, orange color is going to be used. It's going to be applied lightly. Like this. From cervical area, body, incisal area, the color changes gradually. Darker, A3.5, A3, A2. It becomes very gradual and natural looking molar color can be achieved. In this patient, if you look at the initial photo, the patient has very distinctive color traits. On the incisal area, it's very bright. The more you go cervical area, it becomes darker. And there's also a stripe pattern here. In this case, you cannot express the patient's natural tooth with just coloring, and after coloring the basics, after sintering, to apply staining in order to really reflect the patient's characteristics on the tooth. The cervical area is expressed using a 3.5 in a vertical way. And on top of it, A3 is used and coloring is done like this. The coloring agent seeps deep into the zirconia crown and coloring is done this way. As a result, even if you do occlusal adjustment, the color does not disappear. You can say that this is determining the basic color of the crown. Finally, to express the dark bit in the cervical area, in order to express this light orange, cervical color is added. On the occlusal side, the patient's tooth was lighter and cervical A3 was used, although A3.5 was used previously. Coloring was done on the central area like this. Coloring is now complete. Now I'm going to move on to the sintering stage. Coloring stage, once it's all done, you move on to the sintering stage. After sintering, the size of the outcome after milling shrinks about 20%. So now it can actually be used in patient mouth. I'm going to show you the sintering process via the video clip. The crown which was colored is now being placed in a container. The occlusal surface of the crown should head towards the bottom. Once the lid is placed, In order to get rid of the moisture and the agent, you put it in the oven and leave it there for about 5 minutes. You put it in for 5 minutes in the oven before sintering. After 5 minutes, take out the container and put it in the sintering machine. And after determined period of time, crown is complete. After 8 hours, the crown size changes to what can be used in patient mouth. In sintering machine, there's 2 modes. There's normal sintering mode and quick sintering mode. In normal sintering mode, it takes about 8 hours. In quick sintering mode, it takes about 1 hour. If you sinter crown in normal sintering mode, you can get very aesthetic results. As shown, Zirconia crown color is very natural and is translucent. If you sinter using quick sintering mode, although the time is shorter, the downside is that the color becomes wider and more opaque. Therefore, in aesthetic area, it is difficult to use quick sintering mode. Compared with normal sintering mode, it is more white and opaque. As a result, it is used frequently for second molar in the upper. Now I'm going to talk about conclusion. I've talked about coloring and sintering. Coloring determines the color of the tooth. Gradual changes of the color in the natural tooth is expressed on the crown. Sintering process. There is normal sintering and quick sintering. It determines the translucency of the tooth. You need to use it for the right patient and choose appropriate indications. This is the end of my presentation, and now we're going to move on to a Q&A session to address your questions further. First, the question. One needs to be prepared in order to do coloring more naturally. The most important thing is to secure a pre-op image. A natural crown blends in with the adjacent teeth. As a result, if you don't have a pre-op image, it is very difficult to recreate natural color. In order to make a color of crown more natural, you need to have pre-op image, and based on that, coloring and staining needs to occur. Second question. Please tell us indications for quick sintering and normal sintering mode. In most cases, crown goes through normal sintering mode. However, because of patient's circumstance, if crown needs to be made within a very short period of time, if crown needs to be delivered on the same day, quick sintering mode is used. In this case, the crown becomes more opaque and white. There's such tendency. As a result, more so than the general way, you need to intensify the color by 1 or 2 stages. This is the end of my lecture. Next time, I'm going to talk about polishing and staining the sintered crown. Stay tuned. Thank you.